How to get pregnant while breastfeeding with no period. Women who are breastfeeding commonly develop amenorrhea and infertility. Amenorrhea is when you do not menstruate. When you breastfeed your child, your body creates prolactin, which can keep you from becoming pregnant again. However, you can chart your fertility cycle, reduce the amount that you breastfeed your baby, and change your diet in an attempt to become pregnant. Method 1: Getting pregnant while breastfeeding through charting. 1. Understand what charting is. Charting can help you to determine when you are most fertile. When you know this specific time span, you have more of a chance of getting pregnant. Charting is done by tracking your basal body temperature, cervical position, cervical texture, and cervical mucus. 2. Keep track of your basal body temperature. You will need a special thermometer, called a basal body thermometer, in order to be able to do this. When you get up in the morning, take your temperature. This baseline reading is your baseline body temperature. Your basal body temperature will change throughout your cycle as your hormones fluctuate. These changes can help you to determine when you will be most fertile. During the first half of your cycle, estrogen dominates. The second half of your cycle causes a surge of progesterone. This hormone leads to a sudden increase in body temperature as it gets your uterus ready for fertilization and implantation. These days where you see a spike in your body temperature are the days when you are most fertile. The changes in temperature can range from 0.2 degrees to 0.5 degrees Celsius, 0.4 degrees to 1 degree Fahrenheit. You can keep track of your temperature by creating a physical chart. Keep track of your basal body temperature for a couple of months so that you can predict which days are likely to be your most fertile. 3. Keep track of changes in your cervical mucus. Cervical mucus is known as vaginal discharge. This mucus can change depending on which phase of your reproductive cycle you are in. To examine your cervical mucus, look at your toilet paper after you wipe. Check your mucus before going to bed. Keep track of your mucus colors on a chart for a couple of months so that you can predict when you will be most fertile. If you observe clear and slippery mucus for 2 days, you are fertile and can try to conceive. Dry of cloudy mucus means that you are not likely to conceive. 4. Check your cervical position and texture. To find your cervix, stand or squat and place one of your legs on a stool. Insert 2 of your fingers into your vagina and push backwards. You will feel a slightly firmer texture when you reach the cervix. Do this every day to assess the changes of your cervix and keep track of these changes on a chart for at least 2 months. During ovulation, your cervix will be high, soft, and open. The cervix is soft if it feels like the texture of your lips. When you are not ovulating, your cervix will be low, firm, and closed. A low cervix is characterized as being just a few inches from your vagina. The cervix is firm if it feels like the texture of the tip of your nose. Method 2: Reducing the amount that you breastfeed. 1. Wean your baby. Continuous breastfeeding results in the production of more prolactin levels. High prolactin levels can suppress your body's production of estrogen. In order to lower your prolactin levels, you can consider reducing the amount of time that you breastfeed your baby. Techniques for how to do this are covered in the following steps. 2. Feed your baby frequently during the day but try to feed him less at night. Feed your baby as much as he wants during the day. As your baby grows older, he will be able to store more in his belly, which will help to cut down on how frequently you have to feed him. Try to avoid nighttime stimulation so that your baby sleeps without wanting to feed. When you can reduce the number of times you feed your baby during the night, your body may produce less prolactin. 3. Give your baby a pacifier to suck on. Comfort sucking is when your baby latches onto your nipple without actually consuming your breast milk. However, even if your child does not feed, your body still recognizes your baby latching onto you, and will produce more prolactin. To reduce your prolactin levels, hold your baby while he sucks on a pacifier and LT, Ref and GT, Polone SR, et al. Fertility awareness-based methods, another option for family planning. Journal of the American Board of Family Medicine. 2009, 22:147, and LT, Ref and GT. To determine when your child is feeding or comfort sucking, check to see if your child is swallowing. When your child feeds, his jaw will move slowly, and you will be able to see him swallowing. When your child comfort sucks, his jaw will move very quickly and you will see little swallowing occurring. 4. Feed your child a combination of breast milk and formula milk. To cut back on the amount of time you spend breastfeeding your child, feed your child a mixture of breast milk and formula milk. Doing this will give your child the nutrients he needs, while helping your body to lower its prolactin levels. Method 3. Making diet changes to get pregnant. 1. Eat foods rich in omega-3 fatty acids. Omega-3s are helpful in increasing fertility by regulating reproductive hormones, increasing the cervical mucus of egg white, which helps the sperm reach the egg. Omega-3s can also reduce your body's sensitivity to the hormone prolactin, which can suppress ovulation, and boosts blood flow to the uterus, which can aid with the development of uterine lining. Foods rich in omega-3 are cod liver oil, canola oil, walnuts, pumpkin seeds, cashews, avocado, sunflower seeds, almonds, sesame seeds, olive oil, corn oil and safflower oil. 2. Eat foods rich in vitamin D. The active form of vitamin D, calcitriol, plays an important role in female reproduction. Calcitriol has the ability to control the genes involved in the production of estrogen and embryo implantation. The uterine lining is able to produce calcitriol in response to the embryo as it passes through the uterine cavity before implantation. The recommended daily intake of vitamin D is 35 international units, IUs, per pound of body weight. 3. Increase your vitamin B6 intake. This vitamin can help you to restore your luteal phase, which is the time period from your ovulation to your period. It is generally 11 to 16 days long. Vitamin B6 can also help to reduce your prolactin levels, which, as described above, can disrupt your ovulation process. Try to get roughly 100 milligrams of vitamin B6 each day. Foods that are rich in vitamin B6 include whole grains, walnuts, lean red meat, seafood, bananas, potatoes, beans, spinach and fortified cereals. 4. Take vitamin C supplements. Studies have shown that vitamin C increases the amount of mucus in the vagina, which makes the mucus more abundant. This means that it will be easier for the sperm to travel and reach the eggs. For breastfeeding women, it is recommended to get around 65 milligrams of vitamin C each day. Vitamin C can be taken in capsule, tablet, or effervescent form. You can also eat foods rich in vitamin C, such as cherries, oranges, kiwi, red and green pepper, lemon, spinach, and strawberry. 5. Get more zinc. Zinc is a mineral that can help your pituitary gland to release chemicals that promote ovulation. It can also help to boost your pituitary gland's production of estrogen and progesterone. You should try to get roughly 25 milligrams of zinc each day. Foods rich in zinc are veal liver, shellfish, crabs, dark chocolate, lean red meats, wheat germ, watermelon, chickpeas, and pumpkin and squash seeds. Tips. Quit smoking. While you should try to avoid smoking while breastfeeding in general, it is particularly important to quit smoking if you are trying to get pregnant again. The nicotine in cigarettes can inhibit the production of progesterone, which is a necessary part of preparing the uterus for egg fertilization. Consult with your doctor before changing your diet or reducing the amount that you breastfeed your child. Consider talking to your doctor about charting techniques.